Have you experienced a miscarriage and are wondering when it's safe or even emotionally okay to try again? I know this can be a tough and confusing time, but you're not alone. Today, I'll walk you through everything you need to know about pregnancy after a miscarriage, from the medical guidelines to emotional readiness, so you can move forward with confidence and hope of expanding or starting your family. Hi everyone, welcome back to the channel. If you're new here, I'm Dr. Christina Pinnock, a board-certified OB-GYN and high-risk pregnancy specialist. If you find my videos helpful, don't forget to click that subscribe button, or if you want to get more pregnancy tips, check out my newsletter at healthypregnancyafter30.com. Today's topic is a delicate one. I'm going to be talking about pregnancy after having a miscarriage. And for many women and their partners, going through a miscarriage is heartbreaking, and deciding when to try again can bring up a lot of questions and even emotions. And so it's important to know that you're not alone in wondering when it's safe to try again, or even when it's emotionally okay to try for another baby. In today's video, I'll answer some of the most common questions about conceiving after a miscarriage, including what the research says about timing, what to consider emotionally, and how to prepare your body and mind for a healthy pregnancy in the future. My goal is to provide you with information and reassurance so you can consider your next steps in a very thoughtful way. First, let's talk about the emotional side of things. Experiencing a miscarriage is extremely difficult, and everyone processes it differently. Some people feel more ready to try again right away, while other people may need more time to grieve and heal before they start trying again. There's no wrong or right answer. It's completely normal to feel whatever you're feeling. It's okay to feel anxious about getting pregnant again, and it's also okay if you're just not quite ready. But it can help to take a little bit of time to reflect and talk with your loved ones or even a counselor. And they also have support groups for moms who've experienced miscarriages as well. Grieving and healing emotionally can be just as important as the physical recovery. So just remember that there's no right timeline. It's all about what feels best for you and your partner. Now let's talk about what medical guidelines we have about when to start trying again. So after a miscarriage, many women wonder how long they should wait before trying for another pregnancy. To be honest, our research recommendations have varied a bit, but in general, I'd say previously for many years, we were recommending that women wait several months to allow their body to recover from pregnancy. Our more recent studies show that women who experience an early, uncomplicated miscarriage can actually try again sooner than we previously thought, even as soon as after one menstrual cycle. The WHO, which is the World Health Organization, suggests waiting 6 months to try again after having a miscarriage. But again, most of our studies indicate that waiting that long isn't always necessary unless there's specific medical reasons for waiting. That said, every situation is unique, and if your miscarriage was later in the pregnancy, or if you experienced complications or needed a procedure, then you may need to talk to your healthcare provider to determine when would be a good time frame to start again, as they may recommend a longer wait time to allow you to fully recover. But I'd say always check in with your healthcare team before you start trying again if you've had a miscarriage, so you can be sure that you've gotten the all clear, both physically and mentally and emotionally, to go ahead and start trying. Once you have decided that you want to try for another pregnancy, many women ask me about what are the things that they should think about for preparation in terms of their physical recovery. Now, preparing your body for another pregnancy after a miscarriage is an important step, and there are a few things that I'd recommend that you focus on to try to support your body for a healthy future pregnancy. And the first thing I'd say is focusing on nutrition and hydration. Now, after a miscarriage, it's beneficial to focus on a balanced diet that's rich in nutrients that can help to support your pregnancy and fertility, and things like folate, iron, calcium, different vitamins like vitamin C, vitamin D, all can help to support your body as you're planning to try again. And also, a prenatal vitamin is really important to help to ensure that you're getting all these nutrients. Another important way to prepare your body for a future pregnancy is by getting regular exercise. So gentle exercises like walking, jogging, swimming, or even yoga can help to improve the blood flow to your body, lower stress. Both of those things can help to support a pregnancy when you're ready. And if you are thinking about trying again, another important thing to think about is minimizing or avoiding alcohol and smoking. These things can impact your fertility and increase your chances of having complications in pregnancy, so it's important to avoid those. And then lastly, taking a prenatal vitamin that has folic acid as well as DHA and other essential nutrients can help to prepare your body for a future pregnancy. So those are some things I think are important to keep in mind in terms of preparing your body for another pregnancy after having a miscarriage. The last thing I'll touch on is another common question that I get often from my patients, which is, will my fertility be affected after I have a miscarriage? And the answer to that is generally no. If your miscarriage was an early, complicated one, it's unlikely to impact your overall fertility or health. A lot of women find that their cycles go back to normal pretty quickly, usually within 4 to 6 weeks. And for some, their fertility may even actually be slightly elevated in the few months after having a miscarriage. But that's not always the case. Overall, I think it's just important to remember that everyone's body is different, and the key is to work with your healthcare provider, track your cycles, and monitor your health if you're preparing to try again for another baby after experiencing a miscarriage. If you are concerned about irregular cycles or fertility issues after having a miscarriage, you can always reach out to your healthcare provider or your doctor, who can perform some tests if necessary to ensure that your body's recovering well and that there aren't any underlying issues that can impact your fertility. The next thing I wanted to touch on is when to seek emotional and medical support, because trying again after a miscarriage can actually bring up a lot of emotions for many women. They can feel anxious, excited, or even have a mix of both of those emotions. And it's really completely normal to feel nervous and worried about experiencing another miscarriage. And, if you find yourself feeling overwhelmed, I'd say definitely consider reaching out for support. You can talk with a counselor or a therapist or any support groups that you find helpful, but sometimes just sharing your feelings with others who really understand what you're feeling and experiencing can make all the difference. And additionally, if you've experienced multiple miscarriages, then it may be time to discuss with your doctor whether any additional testing or treatment options are appropriate, because having recurrent miscarriages can be linked to some underlying health conditions that may need more detailed evaluation to make sure that everything is safe. Overall, many women go on to have a healthy pregnancy after having a miscarriage. And as I leave you, I just want to leave you with some tips for having a healthy pregnancy after a miscarriage. So once you feel ready to try again, here are a few proactive steps that you can take to help to support your future pregnancy in a healthy way. The first one I'll say is to just try to manage stress. So high stress levels can actually impact you both mentally and physically. And so if you can at all, try incorporating any stress relieving activities. So anything like yoga, meditation, talking, any hobby that helps you to feel relaxed and calm will definitely help in terms of lowering stress. Definitely finding support in loved ones and practicing any self-care techniques that you may have can actually help to ground you and support you as you're thinking about having another baby. The other tip I wanted to leave you with is to track your cycles. So tracking your cycles can help you to better understand your body's patterns, and it's especially helpful when you're trying to conceive after having a miscarriage, just in case those first few periods aren't regular. There are different apps or ovulation trackers that you can use to keep track of your menstrual cycles, as well as when your fertility window is. The next thing I'll say is to make sure that you have a provider that you feel comfortable with, that you can communicate openly with. Your provider is there to help you medically, but they're also a big source of support, and open communication with your doctor can help you to feel more empowered and supported. And if you have any questions about anything that you're experiencing or looking for more reassurance, they can definitely help to guide you along your journey. Those are some tips that I think are really important to keep in mind in terms of trying again in the future for a pregnancy. Lastly, when you do start trying again, one thing I recommend is waiting until you've actually missed your period to take a pregnancy test, because sometimes if you test too early, you can actually be falsely led, and it can be very frustrating and disappointing. And so waiting until you miss your period can give you a more accurate result to help to lower some of that anxious anticipation that you may have after having a miscarriage. Thank you so much for joining me today. If you're navigating having another pregnancy after a miscarriage, Just remember that it's okay to take your time, both physically, emotionally, mentally, and that you're not alone. There's a lot of support out there available if you do desire it. But I just hope that this video has helped to answer some of your questions and help you to feel a little bit more reassured and prepared if you are thinking about having a future pregnancy. If you have found this video helpful, go ahead and give it a thumbs up, and don't forget to subscribe to my channel so you don't miss any new videos. And if you are interested in getting more pregnancy tips, you can check out my weekly newsletter at healthypregnancyafter30.com or find the link in the description box below. All right, take care.